to another live video. I'm here once again joined by Dr. Botros, and I'm Dr. Alan Van Scoyk, once again another chiropractor owner here at a chiropractic company in Glendale. So we've been going through some of these discussions and having some fun talking about some topics that you guys have asked for. And so one of the things that we thought we would do was take it back to maybe a little bit more of what is chiropractic and where did chiropractic come from? A little bit of a history of chiropractic.
Sounds good.
Yeah, I think that this will be fun because a lot of people don't realize what chiropractic truly is and some of the things that it can do and its foundations. So the word chiropractic, what does the word chiropractic mean?
So when you hear the word chiropractic, it's separated into two different parts. So the first part is Cairo. So it is a city in Egypt, which is where I'm born, but its root word actually comes from the word for hands. So Cairo meaning hands and practic meaning practicing with hands, the ability to help people with your hands.
So that's the root of what chiropractic is. Where does its history come from? Well, it starts really with this person right here. This is kind of an obscure picture. Not many people know who this person is. This gentleman's name is Harvey Lillard. And Harvey Lillard was a janitor back in 1895 in Davenport, Iowa. And as the story goes, Harvey Lillard had lost his hearing, and he could no longer hear the ticking of a watch or the rattle of wheels on wagons outside. And one day he stumbled into a man's office named Daniel David Palmer. And Daniel David Palmer was kind of a Renaissance man and did a variety of different things, including healing and ways on trying to fix the body and work with getting people to be more healthy. And when Harvey Lillard came in, he had told him that, hey, I've lost my hearing and things are not going well for me. And so Dr. Palmer at the time said, well, let's see what we can do to help that out. And he went and examined his spine and he found a vertebrae that was grossly out of place. And so what did he do? He racked it back into place. And that racking back into place made a noise, and Harvey Lillard went on and he went away and he came back. And in a few days he said, after the adjustment, my hearing actually was restored. So who was the man that actually did the adjustment? Well, here he is. This is the founder of modern chiropractic. Once again, 1895 in Davenport, Iowa, Daniel David Palmer. And so after this thing that he had found, this new way of healing, he said, well, let's explore this a little bit more. Let's learn about why this is going on. And so he started to do some research, and he traveled the world, and he went out and found people that were doing mechanical styles of healing and looked at some of their philosophies. And he found people that were doing mechanical and physical styles of care back in Greece and back in Europe and Asia and India, and started to realize that this kind of healthcare has been around for a long time, a lot longer than 1895. In fact, the father of modern medicine, or father medicine, Hippocrates, had gone through and done so much physical manipulative care, he had actually written books about it. He had described in all sorts of great detail different things that he had received and gotten benefits from with going through manipulative care. There was master classes all associated with Hippocrates and how he was manipulating patients. In fact, that there was 97 different texts in regards to how he was working with people. So chiropractic has its root and foundation for a long, long time ago for some of the greatest medical thinkers. As time went along, however, and Palmer had started to do more studying, he got a little bit better idea of what to do, and the practice became more and more widespread. And not much longer, even athletes started utilizing chiropractic care. So this is a great article about Babe Ruth and him utilizing chiropractic care. Babe Ruth actually started to use chiropractic care early on in his career, and that was 1914 when he started his professional baseball career, and went on to 1935, I believe. And during that time, he actually credited chiropractic care with helping him do the things that he did. Now, we all know that he wasn't necessarily the greatest of athlete, but he had a lot of things that he was doing that weren't really good. This one, once again, really kept him in the game. As time went along, it became, once again, more and more widely known about chiropractic, And so now we find ourselves where we are today. So tell us a little bit about where we're at today.
So today, in that period of time, like Dr. Van Scoyk mentioned, this has been going on historically for a long time. People documenting and understanding and using spinal manipulation to get better. And now we see that not just Babe Ruth back in the day used to get adjusted, but now every NFL team has their own chiropractor, and most professional athletes and Olympians are also getting chiropractic care. And these are high-level people that are extremely in tune with their bodies, with their mechanics, with their nutrition, and all of that stuff. And they see the value and the importance of chiropractic care, both in preventing issues and injuries in the field, and also helping them with recovery. And so, thankfully, what we have now is with chiropractic students, they actually go through rigorous training, and it's not just a program you can take online or something like that. What you're doing is you're going to go through undergrad, and then you go to chiropractic school, and it's accredited school, and everything is rigorously tested to make sure that, yep, there's a standardized care, and that, everything is good. And then we're seeing that actually if you measure the amount of hours that a chiropractor goes to school for, it's about the same as a medical doctor. So a medical doctor goes to school for about 4,800 educational hours, where the chiropractor goes a little bit shy of that, of 4,600 educational hours. And so it's a lot of school, a lot of books and reading and studying and practicing to get to this state here. So you are in good hands. Interestingly enough, there's several studies that show how chiropractic care can actually help in our day-to-day lives. So one of the biggest ones, of course, now that we're seeing more about this, is the opioid epidemic, this crisis that's going on where people are getting prescribed a ton of painkillers and they're addicted to it. And a lot of times people are given these medications to treat chronic issues, meaning issues that have been going on for a long time. And so I want to go over a study here that goes over that, and the results might blow your mind. So one of the studies here, it's a 7-year study. So over a span of 7 years, they found that patients who use chiropractic care as part of their active and healthy lifestyle were actually 85% less likely to be on prescription medications. And if they were on much lower doses or number of medications than someone who wasn't using chiropractic care as part of their healthy and active lifestyle. So Dr. Van Scoyk, why do you think that is?
That's a great question. Well, when your body works better, it requires a lot less as far as these medications are concerned. It feels better. There's once again studies out there that show how chiropractic really reduces a lot of that pain, to the point where even physicians have said, you know what, I think we're right. I think that manipulation should really be a first-line therapy as opposed to medications. There are some great new guidelines that came out several years ago, actually 2017, and I'll put that up here. In 2017, the American College of Physicians said that the evidence shows that for patients with chronic low back pain, the College of Physicians recommends physicians and patients select non-drug therapy with exercise, multiple disciplinary rehabilitation, and spinal manipulation as, once again, opposed to initial drug therapy. So chiropractic has grown to that stage where all the research is showing this is really the best place to be.
And interestingly enough too, this isn't just going on here. We're seeing that there's all other multiple medical agencies that are realizing the value of chiropractic care. One of them specifically is the Pittsburgh Medical Center, which actually is releasing a mandate saying, hey, before you are required to get surgery, before you're going to get put under the knife, you are required to get at least 3 months of chiropractic care to actually see how that works for you. And we've both seen in our practices patients who were scheduled for surgery and they got chiropractic care, and they can either delay it or cancel it altogether, again with the supervision of their medical doctor as well.
Absolutely. Really great studies out there. So this is a little bit about the background of chiropractic care. This is a little bit about the history. So what we want from you guys, once again, take lessons from this gentleman. Even though he came in, Hearing was an issue, he got great relief. Pain, once again, something that we're fantastic at. So if you have issues, even if you don't necessarily think that we might be the right ones, come on in, let us know, and we'll go through an exam, check out, see what's working, and see if chiropractic care can be right for you.
Absolutely.
If people do want to become a patient, where should they go?
So they can go to chiropracticco.com and look for the Glendale location or any of the locations near you. We are working in the Glendale location, so if you want to work with us one-on-one, that's where you'll find us, or they can give us a call at
414-332-0859. Give us a call. Like I said, you can schedule online if that's something else you'd like to do. Like you said, our website directs us, you right to our schedules, and we can be happy to take great care of you. Otherwise, I hope you found this informative. If you have questions about any of the stuff that we're going through, feel free to let us know, shoot us an email, and we'll talk to you at our next video.